Chiropractic for low back pain.
We know that chronic low back pain is the #1 reason that people come through our doors. And it can come from one of a number of different factors, whether it's poor posture, long hours sitting, not enough stretching or exercise, maybe an old injury, degenerative changes such as osteoarthritis. And when people come to see us for help with their lower back pain, they usually have some very common questions. The first one is, does it actually work? And the answer is yes. Research and decades of patient experience show that chiropractic care is one of the most effective and reliable treatments for chronic lower back pain. For many people, it works as well or even better than medication or physical therapy without the side effects of drugs or the risk of surgery. The next question that many people ask is, how does it work? Well, that's simple. Through precise chiropractic adjustments, we restore proper alignment and movement of the spine. When the spine is out of balance, it can irritate nerves, put stress on joints and muscles, and by correcting these misalignments, we relieve pressure, improve mobility, and address the root cause of your discomfort, which is typically from the spine. What does a treatment plan look like? Well, that depends on your condition. Most patients notice changes within the first few visits, and typically there's an initial phase to reduce pain, followed by a corrective phase to restore function, and then a wellness phase to keep you strong and prevent flare-ups. We'll walk you through exactly what to expect and tailor the plan directly to your needs. People also want to know, does the treatment hurt? And that's a very common valid concern. Rest assured, the adjustments are typically very gentle and safe. Sometimes you might hear a popping sound that's simply gas being released from the joint fluid, but the process itself is usually not painful. There might be a little bit of soreness, similar after a workout or associated with a massage, but it usually passes very quickly. And that brings us to the next question, is it safe? And the answer is yes. Adjustments are considered very safe, especially when performed by a licensed chiropractor. At your first visit, we'll do a thorough exam, take a detailed history, and if needed, x-rays to make sure the adjustments are right for you. We'll also screen carefully for conditions like osteoporosis or fractures or other conditions that might require a different type of an approach, because your safety is always our top priority. Additionally, we hear questions, how does this affect our whole body? And the way that it affects the whole body is because we don't just adjust your spine and send you out the door. We'll look at your posture, your ergonomics, exercise, stretching, even lifestyle factors that might be contributing to chronic pain. In many cases, we'll integrate your therapy with massage, physical therapy, and other treatments to help you heal better and stay better for longer. Is chiropractic drug-free? Absolutely. And that's one of the things that patients really seek out our care for. Chiropractic care is a natural, drug-free, and non-invasive way to manage lower back pain. For many, it's a way to reduce or even eliminate dependence on pain medication. We don't just treat pain, we treat the cause. And if you're living with chronic lower back pain, we'd be happy to be part of your team to help you restore the life that you want.